All right, so you're about to watch a video of detailing, I think it's basically me changing a bandage on Drew's skin cancer right after he had it. How long has it been?
It's been about 18 months.
So it's been about 18 months, and here's the vicious scar that he has. Tell him what happened.
What happened? Oh, after going to the doctor for many years, I found out I had basal-cell carcinoma, and it was like in late September. They diagnosed me with that in early October of 2022. They did what's known as a Mohs surgery, where
Your hair looks crazy. He just took his shirt off.
there was a spot here that was basal-cell carcinoma, which is the most common form of skin cancer.
Because Drew teaches swim lesson and
Well, because I was a lifeguard for
was a
years,
lifeguard,
and
right?
I was in the sun every day for like 6 straight years. Anyway, this Mohs surgery is, if you think of just take like a razor and they just like sit there and shave it off.
How long did it take?
It took like 7 hours because
He was in there a really long time.
he had to scrape stuff out and then
go back and check.
Pull off a piece and then take it under a microscope and then find out that, oh, he didn't get it. He's got to go more deeper. So he cuts deeper, and then he had to check again and found out he had to go deeper. And at this point, they had given me too much lidocaine or whatever. And so they had to wait for me to come down off the lidocaine.
He had a ton of lidocaine.
Before they could give me more, before they could do it. I went into the doctor. It was still dark outside, and I came out. It was dark outside. It was
a whole day procedure, and it started because he had this small spot on his chest really about the size of a quarter.
I would not want to go through that again.
And we kept going to the doctors, and the doctors kept saying,
for 7 years I went to the doctor, and they were like,
"Oh, it's eczema,
part of your
psoriasis.
Yeah, it's just part of your skin."
Yeah, all kinds of stuff they diagnosed. Gave us 5 million different kinds of creams. And eventually he went to one doctor, and that doctor said,
oh, this doctor took one look at it and was like, that looks like skin cancer.
Yep.
And she had a little thing, and she goes, we'll take a little sample of it. And they called me like a day later, and we're like, that is basal-cell carcinoma. Good news is it's treatable. It's the most common. It's the 99% cure rate when they clear it off of you.
So you haven't had any problems since then?
No. And I have friends, bunches of friends that have all had the same thing.
Yes. And so they did cut pretty deep into his pec muscle.
Yeah, like right here, there's a chunk of it they cut out.
Yeah. It's kind of cool. It's got like a triangle shape going on here.
Yeah, so they had to do, this is all, these big points.
And you'll see that
the spot was only here, but they did a graft or whatever where because this skin is real spongy, he cut it over here and then folded it up and stretched it out.
They were going to
and then sewed it up.
It would have looked better, but they wanted to take a skin graft from his neck.
Yeah, they wanted to take some skin from
and
up
then
here. Put it
on his chest, but he didn't.
How bad does it look?
He was fine.
I was like, it's going to be a scar on my chest.
Scar is a scar, and he didn't want a scar on his neck.
They didn't graft this. Which one looks worse? Like, look at this scar.
That is a skiing accident scar. So this side of him is kind of tough. So do you have any words before we show the video?
Don't forget to wear your sunscreen.
Trigger warning, probably. I'm sure the video is gonna. It was the procedure was done, and then we took the videos of me changing the bandage.
The very first time we took the bandage off.
Yes, and it is. It's going to be...
It's pretty bloody.
Lots of trigger warnings. So, yes, this can be avoided if you wear sunscreen.
Yeah, I think the trend right now is they're saying don't wear sunscreen, which is BS. Don't do that.
Wear your sunscreen. Well, what they're saying right now is don't wear, like, chemical sunscreen. You can wear mineral sunscreen. Get those
shirts that are UPF.
Mineral sunscreen, zinc sunscreen.
Or just the shirts that cover you.
Or the shirt. The SPF and UV blocker shirts are great. So
I just spent 4 days out at the beach, and I wore a shirt, and I didn't have to put any sunscreen on.
You did wear, you used a whole bottle of sunscreen.
I did put sunscreen on my arms, and on my face, and on my neck, and on my legs.
Don't tell people that. You spent the time.
But I didn't have to cover my whole body in lotion and stuff, because I wore a shirt.
That's right. A protective shirt, not just any shirt.
A swim shirt.
A swim shirt. That's right. Okay, so here is the video. Without any further ado, Any other last words?
This is long.
Thank you for watching. Don't forget to like and subscribe. Wear your sunscreen. If you saw anything on this video that helped you learn something, please give us a thumbs up. Or like, as the kids call it nowadays. It's like right over here by your nipple.
Yeah, we're rolling.
All right. This is Drew's aftermath. We're going to try to take the pressure bandages off. Drew, why don't you tell them what's going on? Let's just talk while we're doing this.
Okay, so I had some basal-cell carcinoma.
That's right.
Which is the most minor and most common form.
Take them off a little at a time.
Of skin cancer. Amanda is going to try to do her best here, but I feel like she's going to start pulling and I'm going to be screaming.
I should have put my other glove on.
I don't know why you're not wearing 2 gloves.
Because you already started. All right. I'm just going to take the bandage off.
Anyway, so I had to have Mohs surgery.
Let's start with this side.
So
I can walk around to the other side.
I would go with whatever's on top.
Yep, that's what I'm doing.
Work your way down. They did Mohs surgery, and I actually had a very large
I washed my hands, so it's
thing
fine.
on my chest removed, and they had to. I had like a 4 centimeter, kind of sore of this skin cancer. Oh, slow, Amanda.
Okay.
I'm gonna turn this video off and pop you. Easy. Whoa.
Okay.
All right, this is where I've seen
There's
you hold
just
the
a tiny little bit there. It's almost it. Just let me take that little bit. I'll do it very slow. Very slow. Very slow.
Easy.
Okay. But there's like a centimeter left.
That's what I'm saying.
You gonna do it?
Do it. Scissors to cut it, or let me do it.
Okay, do it.
Like.
You got it? All right. Good job. Good job. Good job. Okay. How's it going there? Here, pause this for a second.
No way, we're about to get to it.
We're about to get to it.
Don't you guys want to see this massive hole in my chest? I don't.
I feel like I need to put gloves on. I did wash my hands, but out of an abundance of caution.
See, this is where that's what they did, is they had the gauze pad. I can't do this.
Uh-huh. Just take a break. We ain't in no hurry, right? Just take a break. It's nice and easy. All right, let's start over here on this other side.
I'm turning this video off.
Okay.
We're taking a break.
All right, we're back again. So, I don't know what we were talking about before. Oh, this portion over here by the nipple, I don't know if that's a scientific term. It started bleeding.
My areola.
It started bleeding while he was sleeping. So, how long ago has this been done?
Well, we're at like, what time is it right now? It's like 2:30 or something. We're about 48 hours out of operation.
This is an emotional support cat. She's supporting emotionally.
Right now, the hardest part is getting this darn tape off my skin.
It's stuck right where the blood leaked through.
No, I think it's just good tape.
It's just good tape. Okay, we'll come back in a minute. We're just
like
working
it's a really
through
slow
pulling the
process
tape
of
off.
pulling this damn tape off. That took a lot longer than it should have.
All right, that's the bad spot. So this came out while Drew was in the bed. He was bleeding a little bit. What do you need to go underneath the pillow?
I need like more pillow.
Okay.
Hold on.
Hold on, no. Let me get you. We got one little piece of tape left. The big reveal. All right, now we're not taking off the clear tape. He will go back and they will do a wound dressing change is a week post-op.
Yeah.
All we're doing is cleaning off this excess blood around here. And we're going to slather it with Vaseline. Just drop it in.
I did it.
You did it. Yay. We're going to slather it with Vaseline. Good job, babe. Just relax. No rush. The most important thing is that it doesn't get dried out. As you can see over here, this part right here is a big gaping hole. And then these parts over here are the skin flaps where they pulled the skin back. And
They said to remember that this brown
mhm.
strips
Uh-huh.
can't get wet.
Okay. No, we're just cleaning your skin. Only we're cleaning the skin around the area.
Okay.
That's all. And then we're going to cover it in Vaseline and put a regular bandage over it. And that's it.
Okay.
Ready?
Yeah.
All right. We took the brown bandage off, as you can see. Putting Vaseline basically in the hole.
Random mist.
Yeah. And Drew's doing it himself. He's got a mirror. I've been holding the mirror, but right now I'm holding the camera. Just going to fill it with Vaseline. She said, don't be worried about using too much Vaseline. So once you put the bandage on it, Drew, you won't have to push it in anymore. The bandage will push it
I know,
in.
I'm just trying to get it all into the hole.
Mm-hmm.
I think it has an automatic shut off. Okay, so we're back, and I have bandaged it back up. I know you probably only saw a second of it because I was freaking out about having an exposed wound on my chest. But so we filled the hole with Vaseline and then put their bandage on it and taped that up, and then now we're putting these gauze pads over the thing that they did to
the clear bandage.
They've got these clear bandages over the scars that they did. What they had to do is I had a 4-centimeter wound.
We're going to show you the pictures.
And you'll see the pictures. But then they had to end up cutting a giant portion off of me. You know what I mean? It's a gaping, huge hole. And then they do some weird way of, like, cutting. He said they cut a pocket. And once the man gets done here, they cut like a triangle this way and a triangle this way and a triangle this way, and then they squeeze it all together. And I've never seen anything like that before. And when they told me about it, it didn't make any sense. And they drew me a picture, and it still didn't make sense. And I think you're over here.
No, over this one, this spot right here.
What's important is that air doesn't get to it, and it stays moist. So it was pretty moist when we rolled in there a second ago. And I just put a ton of Vaseline on.
Right on top. Right on top. Right there. What is your pain level? 1 to 5.
It's 1.
1. No pain. Okay. What was your pain level while they were doing it?
Pain while they were doing it during the operation? I mean, when they numbed me up, there was occasionally they'd hit spots where they didn't numb me, and during the cauterization parts and stuff that kind of hurt.
It was an all-day thing.
Yeah, there were 3 procedures. They had to do one where they went in and cut it out, and then tested under the lab conditions or whatever, and saw that there was more that they had to go back and cut more out. So that took a while because they have to do the lab stuff.
I'm just going to press down lightly.
Oh, you're fine. Yeah, and then so that ended up taking, like, the first thing for the results took like 2.5 hours. They said it was only going to take an hour, but apparently one of their machines was down.
There we go.
So it took longer. So we were out in the car and fell asleep. And then I went back in. They're like, we're going to have to cut more. So they cut some more and then had to wait again. It was another, like, 2 hours. And we go back in, and then they were like, okay, we got it all out, but now we got to suit you up. And that took the longest. It took like an hour and a half to do all of that. And that part was actually kind of the scary part, because they'd already put so much lidocaine in me. They'd reached like the maximum dose that you're supposed to give a person of my weight. And they were all like pausing for a second to be like, holy crap, is this guy going to go into, like, I don't know.
But this is a wound care video, so the wound care.
Yeah, that was our
good? Are you
that
hurt?
was our dressing change.
So don't be scared.
That was nowhere near as difficult as I thought it was going to be.
Right. It didn't hurt.
It didn't hurt.
And it wasn't.
This hurts right here
was
where we were
good.
pulling the dang tape off my skin.
Yep.
See that red spot? That's from pulling tape off my skin.
Mm-hmm. So don't be fearful of changing your dressings. Make sure you do it like the doctors say.
Yeah, that's right.
Don't forget, like and subscribe.
Listen
Wear
to that.
sunscreen.